looking ahead to the season, what tips do you have for our female crew to help make sure that they've just ticked off all of the preventative health options that they can do before they go to sea?
I think a big thing with that is thinking about knowing your body. You know your body, you know what problems you already have, you know what you might have suffered with before, you know your medical history. So I think that's the biggest thing. Check in with your GP, make sure you're up to date with everything.
What sort of things do you need to be up to date with?
Vaccines.
Vaccines, yeah. Yeah.
Such a big thing. But also, if you have regular conditions, so if you, I don't know, you've got issues with your thyroid and you're taking medications for it, making sure that you've had your levels before and that you have sufficient medication to get you through however long your stint might be on the yacht. And then even if it's not a long-term condition, if you think about acute and recurrent problems, so if you're prone to thrush or you get recurrent UTIs, making sure that you are on top of that, you're aware of your symptoms, especially things like UTIs, so urinary tract infections. If you are prone to them, then there's a high risk of antibiotic resistance because you're constantly taking antibiotics. And if you keep taking the same antibiotics, your body is just going to go, no, we know this one, we're not going to accept it. And you'll carry on getting the infections. So if you are prone to UTIs, it's a really good idea to go to your GP and get a culture of the urine sample when you do have an infection, just so we know what the sensitivities are for the antibiotics. It might be that you don't get a UTI while you're on board and that's fine. But if you do get a UTI on board and it's been within several months of the last UTI where you got the culture, there's a high chance that those resistance will still be the same. They change over time. But if you've got an antibiotic that your previous UTI was very clearly resistant to, we're not going to give you that antibiotic. And we can at least start with antibiotics where you know that there's a chance that the bacteria will be sensitive to it.
And that's a really good point, because the kits on board boats are designed to treat a range of conditions, but may not have the specific antibiotics that you would choose to treat a UTI that may have antibiotic resistance already built up. So really important. Now, how can they go about getting those cultures done? Is that something that you can just call your GP about, or?
It's generally recommended you do it when you have a UTI. So if they do have a urinary tract infection, I know at the moment there's, particularly in the UK, there's an initiative for the pharmacists to prescribe antibiotics for urinary tract infections, which is fantastic. We all know how difficult it is to access your GP.
True story.
But if you are finding that you're getting recurrent urinary tract infections, so you are getting them more than once in a blue moon, then it's worth just contacting your GP and making an appointment with your GP rather than going to the pharmacist for the prescription. Then when you go to the GP, if you just explain to them that you are suffering with recurrent urinary tract infections, you've taken lots of antibiotics, you're concerned about resistance, you're due to be moving to a yacht for X period of time where you might not be able to access these sorts of resources, then there's absolutely no reason why they wouldn't do a culture for you.
That's really, really good advice. And let's talk a little bit about once they are on the boat. Why is it so important that they do all this beforehand? What do we know about the standard or lack of standard of quality healthcare where a lot of our yachts like to cruise?
Yeah, I mean, it's a minefield. So it's always best to do it in your home location with a language that you are familiar with a doctor that you may be familiar with, hopefully, depending on how often you need to see your GP. But in terms of then going onto the yacht, so obviously if you have a MedAire kit, then you will have some antibiotics. But as we've said, there's a level of resistance in some antibiotics, and also there's not a weak or a strong antibiotic. There is an antibiotic that tackles a specific bacteria that may be present in specific infections. So one antibiotic might be absolutely fantastic for urinary tract infections, but then if you have a chest infection, it's just not going to be the right antibiotic because it's not tackling the right bacteria. So we can make recommendations for antibiotics to a point, but there is limitations on that, both from antibiotic resistance, but also actually whatever antibiotic and bacteria that you need. Then thinking about shoreside accessibility, it really, really varies. So even if you think you're going to the Med, we've got the Med season coming up. If you're going to the Mediterranean, European healthcare standards are generally incredibly high.
Yeah.
But how good is your Italian?
Not good.
So even if the healthcare is great, there might be a language barrier. There is almost always going to be some sort of language barrier where you're not able to tell your story enough or clearly so that the doctor can fully understand it, and the doctor is not going to then fully understand it. And then if they do make recommendations for you, are you going to know what they're telling you? How many times are you taking that antibiotic? And what was that other advice that they gave you? It's not entirely clear. So even if you're going to places where the healthcare standards are high, you've got to think about that, those additional logistical barriers.
Yeah.
On the other side, you may be going somewhere where there is no healthcare, where there's maybe a small clinic that's staffed by a nurse, and actually the only access they have to doctors is on the other side of the country via a telehealth system. And they don't have a pharmacy, and they don't have labs, they don't have imaging. So actually the healthcare that you think is accessible to you is just not going to be sufficient enough to manage it. So if you think, we're going back to the urinary tract infections, you are not going to get urine cultures in somewhere where they don't have basic laboratory capabilities. And unfortunately, that is the beautiful remote places that the yacht goes. Absolutely beautiful, lots to see there. Access to healthcare may be limited.
And I guess this doesn't even have to be somewhere that remote. I mean, just some of the beautiful islands of Greece
Absolutely.
have very limited capabilities.
Yeah, absolutely. And there's so many islands off Greece. And it's the same thing. What we think, oh, well, there's people living there, so there must be healthcare there. But actually, there's people living there who have been brought up knowing that if they need healthcare, they need to get a boat to a different island. And so they are much better at preventative medicine. If they feel as though there's something coming on, they don't wait for it to get worse. They just go and get the care. Whereas I think we, westernized individuals, are accustomed to just being able to get healthcare at the click of our fingers. And so we're so bad at preventative. We just wait until it's really bad and then realise that there's nothing accessible to us.
Which leads me perfectly to my next question. So we've done all of our preparation and now on board. What are some of those signs and symptoms never to ignore?
I mean, anything. I think you know your body. And I think that is the most important thing, especially as women, because we are so bad at advocating for ourselves. We get pain once a month for several days. And that's just normal.
Yeah.
And so if someone asks you if you're in pain, you're like, oh, it's about a 2 to 3. For someone else, that might be a 7 to 8 out of 10 in severity. But we're so used to just compensating for pain that potentially it's misinterpreted. So I think just knowing your body, listening to your body, and knowing when something's not right. If you are starting to feel fatigued, if you're noticing increased headaches, if you've got pain anywhere, any abnormal discharge, changes to eyesight, things like that, anything that you think is abnormal, you need to escalate early, just so then it can be assessed and made sure that actually it's being managed. Because it could be something as simple as you're in a hot location, you've got headaches, you're a bit dizzy. you're actually just really dehydrated, and then you can deal with it there. Whereas if you wait and leave it, then you might end up being severely dehydrated and go into something like a shock, so where you've got lesser blood volume because you're not hydrating enough. So it's just about listening and saying, I just need to run this by someone just to make sure that it isn't something, and if it is, I can do something about it before it gets severe.
That's a really good point. And I guess the environmental considerations of our yacht crew working on board in hot locations, they're on their feet constantly. What other environmental considerations are there that we need to be thinking about when we go on board?
Sleep.
Sleep, lack of.
I think sleep is a really big one, and it's a really hot topic at the moment. And I think especially, again, with women, you've got your hormone fluctuations. You are very, very likely to feel severely fatigued around that period of the month. And acknowledging that and taking sufficient rest is really important. And actually, I appreciate the shifts, the timing. When you've got guests on board, there is just no prioritization for that. But if there is a chance to advocate for yourself and make sure that you're getting that rest, take some eye masks, take some earplugs, whatever you can to actually block out the noise and the light, and reduce disruptions, is really important.
And that's, easy for us to say, right?
Exactly.
Sat here. But I guess what we need to also consider is what happens if you don't look after yourself and it does get to the point that you're requiring shoreside assistance. We've already talked about the fact that that might not even be an option, depending on where you are. But also operationally, that's quite challenging. I mean, what are some of the key concerns that you hear from crew when you do recommend that somebody goes shoreside?
It's really difficult, and I understand that people call us and they really want for us to just fix it then and there. We've got a kit, we've got everything that we need. Can we just sort it out quickly? And so I understand that it's frustrating when we say go shoreside. I think it depends on if there's guests on board or not.
Yeah.
From what I've experienced, if there's guests on board, no one's being seen unless they need it then and there.
Yeah.
They've lost a limb, there's blood, there's something that really stops everything. But otherwise, you're on board until the guests are off, and then you get seen, which can mean that potentially for your low risk lingering infection or something that's been niggling at you for a bit, actually you've then got several days where it's not addressed and you're carrying on doing a high intensity job where you're on your feet for hours, you're getting no rest, and actually it then just gets worse. You've got a slight lower back pain, and then you're heavy lifting and running up and down ladders and stairs, and it just gets worse and worse and worse to the point where actually what could have been a simple fix turns into something that's far more complex and needs multiple investigations. And then you're looking at multiple trips off the yacht rather than just a quick hop to the local clinic. You're then looking at, okay, we're anchored, we need to take a tender to shore, and then you've got to get the taxi, and it all becomes more complicated. So again, you might feel stupid calling because you've got a headache.
Yes.
But the earlier you can deal with it, and the earlier you can speak with someone who is medical, who can complete a triage, can give you medical advice, even if it's teaching you to suck eggs, even if we're telling you really, really obvious things, at least you have the reassurance that you've had someone to speak to, and you at least know that you're on the right path. And if it does get worse, you can check back in, and then they can amend the recommendations accordingly.
And I guess knowing what to look out for in terms of a situation that does need to be escalated. You know, we appreciate how difficult it is operationally to be able to get shoreside. It's never just the one patient, is it?
Exactly.
It's a tender driver, potentially a chaperone, and they're out for hours. So, you know, absolutely, where possible, treatment on board is always preferred.
Yeah.
Particularly when we've got guests on. But I think knowing when to say, actually, operationally, this is the right decision to make, because otherwise, if we wait a week, we're not out for a couple of hours. We're potentially having to be disembarked and sent home. So, really, really good advice. I'd like to talk a little bit about the points of escalation on board. So we've talked a lot about the medical officers on board tend to be the most medically qualified, tends to be captains and chief officers. And at the moment, and it is changing, which is great, but at the moment that is predominantly fairly male dominated in terms of the roles, which means that as a female head of a department, you could potentially have stews coming to you with some pretty delicate problems because they are not going to want to go and escalate that to 50-year-old captain. So, and there are lots of wonderful captains out there that would be perfectly great at handling this kind of conversation. But the reality is we've got people that aren't necessarily trained for it, that are having to be that point of escalation. What advice can we give to those female HODs, and what are the sort of questions that they should be asking to help that crew member to be able to express what's actually going on?
Yeah, I think, to be honest with you, the easiest thing is making someone feel comfortable. As soon as someone feels comfortable, they're more likely to share the information with you. Even if you don't know what you're meant to be asking, you're not medically trained, you don't know what sort of information you need, as long as that person feels comfortable with you and has the confidence to be able to tell you what their problem is, they're more likely to offer information. If you are not medically trained and there are specific questions that you want to ask, just do a head to toe. So just think about the head and then all of the important body parts until you get down to your toes. You may or may not get the answers, but at least then you've ticked off some boxes. Have they got headaches? Have they got changes to their vision? Even if it's not related to the problem at all, at least you've kind of done your head to toe. It's an easy way of doing it for a minor problem. I think that's probably the best way that they can address it. The main questions we will always ask is pain.
Yeah.
Is a really big thing, and what it looks like, because from our point of view, we can't see you. And even if we have you on video or have you on camera, it's not always clear. So the biggest thing from a medical professional's point of view is we always do an end of bed assessment. So we look at you.
What's an end of bed assessment?
Look at you.
Okay.
Because as soon as you look at someone, you know if something's wrong or not. Whether you are medically trained or not, you look at that person, you think, oh, they're a bit blue. That's not right. You will know. You'll know what this person usually looks like. You can say, your eye looks a bit swollen today.
Yeah.
You're going to know that from a visual point of view that we are never going to be able to know. So if you can tell us what you see, do a quick head to toe, swelling, pain, changes in how anything looks or how anything feels. So you're thinking hot, cold, perfect. That's a good start.
And I like what you said about making them feel safe. We've seen some horrible survey results that indicate that there are high levels of sexual abuse going on within the yachting industry. In that specific situation, what can HODs do to protect that individual, and medically, what are the important things that we need to consider?
Pre or post assault?
Let's say post.
So post assault, think about their safety, remove them from any additional exposure, any risk, any unnecessary people being around. The last thing they're going to want is for you to ask questions. So don't ask questions. Just let them be in their sadness, their emotions, whatever they are feeling at the time, let them be, and they will offer up the information if they need it. But don't probe, don't push. The immediate instinct is to say, go and have a shower, wash it all off. I understand that, and I'm sure that's how most people feel as though they want to treat it. But actually, if that is then something that leads into any sort of criminal action or further investigation, then there are tests that may need to be completed that would be contaminated by washing. And so I understand that that is an instinct, but actually thinking about things like that, and I'm not a security professional, but we do have a security team here. So if we were to get post-assault calls, there is a very strict process for how those are managed, and it's managed medically by the medical team, but also we have security team on the line as well, because there are so many security considerations that you would have, and they can offer that expertise that we just simply can't. But I think most importantly is just not pushing that person and letting them speak as they feel comfortable too, and not probing. Put them in a safe place, a quiet place, let them process it. And if possible, at an appropriate time, then look into things like counselling and mental health support.
And I think that's a really good example of where, as a head of department, calling in somebody who can support with all of those elements, because as you say, it's never just one. There's never just a medical consideration. There are so many other things to also bring in.
Yeah.
Could maybe talk a little bit about the strains that female crew and all crew are under. I mean, it's an incredibly stressful environment being on board. What advice would you give crew members who are feeling the pressure? What can they do, and you know, what can we do to support them?
Yeah, I mean, we've spoken a lot about sleep and sleep deprivation and long hours. So any normal human being is going to feel tired, whether that is physically or mentally. They might just need someone to talk to, and a lot of people don't want to speak to their families because they don't want them to worry, but also they don't feel as though the problem is big enough to justify speaking to anyone else, and that they're just making a fuss about nothing because they're just tired. And so people make up so many excuses to not get counselling, but actually it's such an underutilised resource. And just having that anonymous person who has no connection to you whatsoever, who can just talk you through how you're feeling and coping mechanisms, is so, so important. And I know that there's lots of resources within the yachting community in terms of accessing mental health, but also from our point of view, we have a partner that works with mental health and counselling and can support both telephonic counselling, but also face-to-face counselling if that's preferred in multiple different languages. Because again, you might not have English as your native language, and so actually communicating with your crew or your colleagues or whoever you have around you might be more challenging because you're trying to communicate in your second language. So having that resource is really, really helpful. And if you feel as though you're suffering, you're suffering. So give yourself that time to say, actually, I need a bit of help. It doesn't mean that I'm weak. It doesn't mean that I have a problem. I just need someone to talk to that I don't work with, I don't share a room with. I need some space, and doing that is underrated and super important.
I think that's really good advice as well, to call in early. Don't wait for it to be overwhelming. change is difficult, pressured environments are difficult. It's okay to want to chat through that. And I think the bit that we forget is our crew members can't go home at the end of their day. They are living and working with the same people, and you may or may not get on with all of those people. So having somebody separate to the crew, and as you said, separate from family is so, so important.
Yeah, and just that protected space. Just being able to step away and have some time on your own, because we all know how overwhelming it can be to be with the same people 24/7, and actually sometimes you just think, oh, I need a break.
Yes.
I need some me time. And actually being able to have that with someone who's not related to you, doesn't work with you, is completely separate from your environment, can be really refreshing. So even if it's just, I just feel tired and I don't really know how I feel, perfect. At least you've got someone to talk to. The resource is there. Take it early, so you can have that protected time, so that hopefully they can help you find coping mechanisms so it doesn't get worse. Because ultimately, if it gets worse, it's much more difficult to address, and then there's the risk of it impacting your sleep, impacting your diet, leading to panic attacks, other symptoms that you might have. You might have headaches, but all of this can lead up to more severe conditions. So same with the physical health, mental health, tackle it early and make sure that you've got that support.
And what difference does having a professional counsellor as that person on the other end of the phone make versus just calling a friend?
They have coping mechanisms.
Okay.
I think if you speak with a friend, I think that's fantastic. You've got someone who you can confide in, and I don't think that that's a resource you should stop using. Even if you are speaking with a counsellor, if you have that friend that understands you, you've known them for ages and they know how you work, they know what makes you happy, they know what makes you sad, then keep speaking with them. But having that additional support not only relieves some of the pressure from the friend, so they don't feel as though they're responsible for you, but also they might have mechanisms to manage it that potentially your friend might not have. They might be able to talk you through the way you process thoughts, or there's lots of other resources out at the moment. Things like, a lot of people are into journaling, so writing things down, thinking about the way that you process your thoughts and trying to separate them into something that's positive and something that's negative, and balancing the way that you manage those thoughts. And also really simple mechanisms to help with sleep, and how you can balance your appetite, potentially think about the way that you're eating. They'll be able to provide you with lots of other resources that potentially your shoulder to cry on might not be able to do.
And hopefully then keep that person on board and doing their job effectively. I know there's a lot of fear amongst crew of reaching out and how that might impact their employment opportunities. But I think, one of the key things is actually, if you do it early, it won't impact your job.
Exactly.
The chance of you being able to continue being effective in your role is that much higher if you seek that support nice and early.
Absolutely. And I think that's been the key message the whole time, is get the help early, no matter how silly, small it seems. If you get it early, you can address it earlier, and then it won't become something more severe, because it's when it becomes something really severe where you're starting to look at your shoreside evaluations and needing multiple investigations, and potentially it breaching the limit of what is really safe to do on a yacht before you need to go home, and then it starts becoming more complicated.
There's one last thing, just going back to the health side of things. HODs, female or male, may not be aware of some of the sort of key inclusions that they might want to have from an equipment or medication perspective on board that might support their female crew better. And as we know, the the MSN 1905 guidelines are fairly sparse when it comes to female health specific requirements. Have you got any recommendations for certain items that would be really helpful for them to have on board?
Yeah, I think anything to do with personal sanitary, so your normal menstrual equipment that you might need, depending on what you're encouraging them to bring versus what, if you've got lots of young people, potentially they won't have the initiative to bring enough on. So having spares,
I guess it goes
always,
back to that preventative.
Yeah, it's always great.
Being prepared.
Unfragranced soaps. Maybe if you're thinking about female health specifically, a particular antibiotic that might be helpful for urinary tract infections in females. If you think about thrush, from what I remember in the guidelines, there's mention of it, but I think that there's like an antifungal tablet, which actually it's not really going to do anything for thrush. So having your thrush creams, your pessaries, fantastic, love them. And you can get them over the counter so easily, but it's not something that you're going to see in a pack anywhere. And so what could be a really easy fix would be slightly more complicated, and you try and find that in whatever foreign language there is, try and translate it. So little things like that, depending on how many crew they have on board, what capacity there is for that. The other thing that, it's really silly, not necessarily in a kit, but things that women should think about bringing on board with them, talking about thrush, is the uniforms are very commonly quite synthetic materials. And so what that means is it encourages sweat and the holding of heat. And what that means is there's more bacteria, there's more growth of things that you potentially don't want. And so things like thrush are going to be more common. And so while they can't choose their uniform, they can choose their underwear. And to avoid synthetic underwear on top of synthetic uniform, which is just going to rub and cause so many problems, if they can get pure cotton pants, that's a big help. And it sounds very simple and a bit like I'm sort of an old lady, but a good old pair of pure cotton knickers will help.
Okay, heard it here first. That's a really good point, though. I think, there are a lot of uncontrollable elements to being crew on board, and you can control your underwear.
It's not sexy, but
and just on that, thanks for your help. We've actually created a section within the MedAire shop with female health specific medications. So if anyone's looking to stock up and make sure that their female health are looked after, you can go there.